And let me just emphasize what was said earlier. You know, last year we all requested this information when it came to these Medicaid cuts and the impact repealing the Affordable Care Act would have. And when it seems to me it's incumbent on you, when you put forward a budget that has Medicaid cuts in it, you analyze all the impacts and you're able to tell us specifically, very specifically, what impact is going to happen with specific facilities so that we can know what the result is going to be. As I mentioned in my opening, I've heard from a number of tribes in New Mexico who are particularly concerned about IHS's proposed budget that would cut preventive health funding by $81 million from fiscal year 2018 levels, including a complete zeroing out of IHS health education and community health representatives funding. As one Pueblo leader recently reminded me, community health representatives come from the communities they serve, which means that they have the necessary cultural understanding to identify and respond to their members. That cultural understanding is key to addressing the toughest public health issues on the ground, including substance abuse and addiction. And I would note that one of the key pieces of combating the opioid epidemic is putting more resources towards prevention, both addiction prevention and prescription misuse. Admiral Miyake, do you see a misalignment between the goal of addressing prevention as part of a comprehensive opioid response plan and cutting preventive health care funding at IHS? Could you talk about the importance of these preventive health programs in addressing the opioid crisis?
Thank you, Senator Udall. And I'll start and then ask Dr. Todt to support me in this as well. With regards to the proposed cuts for both the community health representative and the health education programs, there are some concerns that have been expressed internally with the data that was available to be able to justify that these programs were efficient, effective, and accountable. Since this proposal has been released, we've had robust discussions with tribal leaders and other external stakeholders about the importance of the CHR programs and how they play a major role in our interdependent system of care. And they are the ones who are out in the community, checking on elders and others with chronic health care conditions in some of the most rural and remote locations. So I've come to realize that there's a significant concern with the workload not being reported adequately, and so we're not receiving a full picture of what's actually being done by the CHRs and the health educators. So our data identifies that we've had more than 1 million fewer encounters or patient visits. However, we do know that those 1,600 plus CHRs that are working hard every day are doing their jobs, but they may be documenting their visits on a paper, PCC is what we call it. It's a paper document that identifies the work that they did, and that information that may not be getting captured when they return to the service unit. Also, we have interconnectivity issues with different EHRs being used. Our CHR line, about 95% of the community health representatives have been contracted or compacted. And so the majority of that work is taking place in tribal communities. And in the health education side, about 70% of the health education program has been contracted and is being run by the tribes. So I think we have a data issue in not being able to capture all of the work that is taking place. And I would ask Dr. Todt to share a little bit more about some of the vital services that are provided by our CHRs and our system of care.
So we definitely value our CHRs. We have more than 1,600 community health representatives representing over 250 tribes in all 12 areas. And we know that the services that they provide include patient visits related to diabetes, dialysis, hypertension, nutrition, and heart services for elders. And we've heard loud and clear from tribes that they value this program. The budget priorities were to prioritize direct care services and are no reflection on the value of the CHR program.
Yeah, thank you very much. And I would just emphasize again, I mean, I've heard from many of my tribes, and I would just add, like to add several letters from my pueblos to the record, Madam Chair.
They will be included.
Thank you. The